Well, in talking about skin cancer, there's multiple types. Some are more superficial and easier to treat. On the other end is melanoma, which is a very aggressive skin cancer that can sometimes metastasize and kill people. Some of the superficial cancers, once they're cut out, you're completely cured. Others you have to be more vigilant with. And what we try and do is make sure that we have a clear margin when we remove the cancer, and then whatever the defect is, that's where the plastic surgery part really comes in to rearrange tissue and try and restore things as best as possible, depending on the size of the defect. So different procedures for skin cancer can include just a simple excision and then a closure with just a simple line, and then we try and place that in a good position so that it's less visible. Sometimes we use local tissue where we move tissue from one side of the cheek to the other or one part of the nose to the other to fill in a defect. That's called a flap or adjacent tissue transfer. Based on the different types of skin cancer, that would change what your long-term expectations would be or what you would have to do for surveillance in the future. For example, basal cell cancer is very easily treated in most cases by just a simple excision and closure, and that's a complete cure. Squamous cell cancer is kind of in the middle. Sometimes there can be metastases with that, so we're careful to look for that, and that's based on the depth of invasion of that type of tumor in terms of how aggressive we have to be and how much concern we have to have in the future going forward. Some of those patients, whether they have positive lymph nodes or not, may or may not need some radiation therapy. So there are some longer-term implications for squamous cell cancer, although some of them are also very superficial and can be treated like basal cell where they're excised and then the treatment is complete. Clearly the most aggressive type of cancer is melanoma, where we're always concerned about lymph nodes and the depth of invasion of that tumor because those are prognostic signs in terms of how long the patient might have in terms of survival in some cases versus whether we have to be vigilant for recurrence. There's also a lighter version of melanoma, not that I wish that on anyone, but called melanoma in situ, and this is the early stages of melanoma where it's not invasive at all. Clearly that's the best time to catch a melanoma and excise it, and that can be a cure as well.